Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist and I have been wanting to make today's video for a long time, and a lot of you guys have been requesting this on Instagram and YouTube. So today we are going to get into an updated video about TFCC injuries and how to manage them. So without further ado, let's get into the video. First things first, I do want to say if you suspect that you might have a TFCC injury, and particularly if you've recently had a fall on an outstretched hand or any kind of trauma, make sure that you call your doctor, get in and see them, get any imaging done to rule out, fracture or other possible injuries. But it's always really helpful to have your doctor properly give you an exam and give you a diagnosis. That way they can recommend a appropriate plan of care for you. So if you haven't done that, that is the first step. And if you have done that already, the four things kind of that come to my mind when I'm thinking about managing a TFCC injury or providing rehabilitation guidelines for a TFCC injury, I think about four main components. I think about braces and splints, like that period of immobilization. I think about activity modification, pain and edema management, and then certainly exercises. So I think today I'm going to kind of break the video up into two parts. The first part, this part that you're currently watching, we're going to talk a little bit about the first three things, kind of the general rehab guidelines, and then the fourth item, the second part of the video, which I'm releasing together, so you'll have it already ready for you, is going to be a follow-along exercise program that you can do. So let's start off by talking about braces and splint options. It is really going to depend on what phase of recovery you're in, the severity of your injury, with what type of brace is going to be appropriate for you. So that's why it's important to talk with your doctor so that you can get an appropriate plan of care for your case. But I just want to go over some of the options. Typically in the acute phase, if it's especially been like a traumatic injury, like a fall, usually, it's a hard sell, but usually what is most helpful is wearing a long arm or a Munster or sugar tongue orthosis. These are to limit forearm rotation, to allow the tissue to heal. They also limit wrist motion. So they're very restrictive. They hold you at about 90-degree angle. But the idea is that if we can immobilize the tissue, it will help stimulate healing, and especially in that acute phase. Once you move into a more chronic phase, and maybe you've done that initial acute phase of immobilization, probably you're going to end up in a wrist cock-up orthosis or an ulnar gutter orthosis. These can be used for weeks, sometimes a couple of weeks more during the day. Really depends, but these can be definitely helpful in limiting wrist movement, providing a little bit of support and stability, and certainly at night when you sleep to avoid putting your hand in awkward positions. And then the third type that tends to be really helpful is wrist strapping that are specifically developed for TFC injuries. Two of the really common ones, and ones that I have experience working with and like, are the wrist widget and the bullseye brace. I tend to recommend the wrist widget just because I've had more patients use those and people like them. I have a sample in my clinic, and so when patients come in with this kind of injury, we can try it on them. They can test their weight-bearing test and see if it does make a difference for them in their pain. Those are really handy to have for activity, because these injuries take a long time typically to heal, and even once the ligament is healed, you still typically have pain with certain activities for a long period of time as you're building your strength and stability and proprioception back. And so wrist widget or bullseye brace, some sort of wrist strapping device, can be very, very helpful. With regards to pain management and edema management or swelling management, TFCC tears are typically more painful than they are swollen, but with any soft tissue injury, we do have some amount of inflammatory process going on, and increased in inflammation, like a lot of swelling, can increase your pain, so it does help to kind of manage those. Things that can help with swelling are elevating the extremity above your heart, doing movement in that position, compression, things like a compression sleeve or compression glove, and then ice certainly can be used as well. For pain management, you can do heat in the forearm muscles, you can do ice, you can do some deep tissue work, massage of the forearm muscles. A lot of times with period of immobilization or having to guard, your muscles do become very tight, and so you can do some self deep mobilization. Or my favorite technique, get 2 tennis balls, put them together in a sock, put the sock down on the table, and then roll your forearm out on top. That feels usually really, really good. And I actually have a YouTube video about how to make that too, so if you want to check that out, I'll post it below. And last but not least, activity modification. So obviously you want to avoid the aggravating activities and try to modify or adapt the way that you do certain things that are causing pain so that you can still get through your day. Typically things that are going to cause pain are sustained repetitive gripping or tight gripping, rotation, particularly with loading, and then going into ulnar deviation, especially with lifting. So I don't know if you've noticed, but a lot of things we tend to kind of pick up in this position, plates, laptops, a lot of different things. So if you can get in the habit of kind of getting underneath things with 2-hand support, keeping the wrists really neutral, or hold things with both hands, or carry stuff on your forearm, your elbow, your shoulder, like a grocery bag. You don't need to hold that in your hands. You could put it on your elbow or your shoulder. Pots and pans, right? We lift in that position with a lot of weight or load. So get an oven mitt, get under the pan so that you can lift. Those things are going to be typically helpful in reducing your pain, but also letting the tissue heal and not overstressing it.